Erectile dysfunction, or impotence, is a man's inability to get or keep an erection that allows sexual activity with penetration. Erectile dysfunction is not a disease, but the symptom of some other problem, physical, psychological or mixture of both. Don't worry about occasional failure to get or keep an erection. This is normal. Some of the causes include drinking too much alcohol, anxiety and tiredness. Unless it continues, there is no reason to be concerned. However, ongoing erectile dysfunction should be investigated by a doctor. Treatments for erectile dysfunction include medications given orally, usually tablets, counseling, vacuum penile pump devices, injections directly into the penis, and penile prosthetic implants. Causes of erectile dysfunction. Doctors used to think that erectile dysfunction was mainly caused by psychological factors, such as anxiety or depression. In fact, most cases of erectile dysfunction are caused by physical illness. Psychological problems cause only 1 in 10 cases of persistent erectile dysfunction. Physical erectile dysfunction happens over a period of months or years, and is often a gradual loss of function. If the erection still occurs spontaneously overnight or in the morning, the problem may be psychological. Erectile dysfunction can be due to physical illness. Erectile dysfunction is frequently associated with conditions affecting the blood flow in the penis. Diabetes, high cholesterol, hypertension, high blood pressure, cigarette smoking and obesity are often involved, and there is a strong association between erectile dysfunction and cardiac, heart, disease. Men who have multiple sclerosis may also experience erectile dysfunction. Psychological factors. A man's sexual drive or performance can be affected by stress such as problems at work, relationship difficulties or financial worries. Psychiatric conditions, and feeling depressed or anxious about poor sexual performance can also result in a failed erection. A combination of physical illness and psychological factors. Physical problems with maintaining an erection may cause the man to feel anxious about sexual performance, which makes the problem worse. Unknown. In a few cases, neither physical nor psychological causes are obvious. Vascular disease is likely to be the underlying cause in these cases. Diagnosis of the cause of ongoing erectile dysfunction. Ongoing erectile dysfunction should be investigated by a doctor. While occasional erectile dysfunction is normal, ongoing erectile dysfunction can be a symptom of a serious physical illness. It is important that your doctor fully investigates any ongoing problems to check for any underlying medical cause that may also need treatment. This may include heart and blood vessel diseases, diabetes, high blood pressure or high cholesterol. Tests can determine if the blood flow to the penis is affected. Blood tests can also help to determine if hormone problems, such as low testosterone, are causing the erectile dysfunction. Once you find out whether your erectile dysfunction has a physical or psychological cause, you can get the proper course of treatment. Treatment for erectile dysfunction. There are many treatments for erectile dysfunction. These include changing your prescription medication if it is the cause, psychotherapy and counseling, oral medication, tablets, such as Viagra registered, Cialis registered and Levitra registered, external vacuum penile pump devices to create blood flow, injections directly into the penis, such as Calverject Impulse registered, penile prosthetic implants, hormone therapy, rarely given, vascular surgery, rarely undertaken. The first approach is to treat the underlying cause if one has been identified, or if not, to use treatments to promote a better erection. Doctors usually start with the least invasive treatment, such as tablets. If that fails, they may suggest more complicated injection treatments or surgery. Sometimes, treatment of the cause may restore erectile function, for example, testosterone replacement, resolving substance abuse problems or withdrawing medication that may be causing the erectile dysfunction. Mostly, treatment aimed at directly restoring erectile function is necessary. There are many treatments aimed at restoring erectile function. These can be grouped according to their level of invasiveness, being non-invasive treatments, Minimally invasive treatments. Surgical treatments. Non-invasive treatments for erectile dysfunction. Non-invasive treatments include reducing risk factors by treating disease or depression, oral medication, tablets, counseling and external devices such as vacuum penile pumps. Medication, usually tablets, is effective in about 70% of men with erectile dysfunction. Brand names include Viagra registered, Cialis registered and Levitra registered. These are known as PDE5 inhibitors. They inhibit a particular enzyme in the penis, improving the erectile response to normal sexual stimulation. Tablets should usually be taken at least 1 hour before sexual contact. With Cialis-registered tablets, taking a lower dose on a daily basis can allow more spontaneous sexual activity. Fatty meals and large amounts of alcohol can interfere with the body's absorption of some of these medications. Side effects may include facial flushing, nasal congestion, headaches and indigestion. Although these medications act in a similar way, there are important differences between them, such as the period of time for which they are active. Your doctor will help you decide the best treatment for you. Oral medication may not be suitable for all men. Men taking nitrate-containing heart medication should always consult their doctor, as erectile dysfunction medication may interact with these medications. Psychotherapy and counseling can help if one of the underlying causes of erectile dysfunction is psychological. Counseling can also benefit a man who has lost sexual confidence, even though his erectile dysfunction is caused by physical factors. It may be provided by your doctor, a psychologist or a psychiatrist. Your partner may also be involved. A vacuum device is a pump placed over the penis to create blood flow. It draws blood into specific tissues of the penis, the two corpora cavernosa, mimicking a normal erection. Placing a rubber ring around the base of the penis can help make it rigid enough for intercourse. This can be useful when a man is able to get an erection, but has difficulty maintaining it. Devices such as vacuums and rings are not always successful. Side effects may include penile pain, numbness, coldness and difficulty ejaculating. These devices need to be properly explained and fitted, and are best used after consultation with the doctor.